It's invisible, but I see it, and we will make it visible. And that's the core of this work, and that's what makes entrepreneurship so great.
Welcome to Startup Health Now, the podcast about the entrepreneurs and innovators shaping the future of health. I'm Logan Plaster. There's this famous moment in A Christmas Carol by Charles Dickens. Ebenezer Scrooge has been brought to a gravestone by the ghost of Christmas yet to come. As he reads his own name on the grave and realizes what it means, he pleads with the ghost, saying, "Are these the shadows of the things that will be, or are they shadows of the things that may be only?" This really is the central question behind Nightingale Health, the subject of today's podcast. This Finnish company that Startup Health backed in 2016 uses a new kind of blood testing to predict future disease risk so that people can change the course of their health before it's too late. They've designed a way to analyze blood samples that pulls 250 times more data from that sample than a typical test. Then they use AI and machine learning to correlate that data with future disease risk, like the risk of diabetes or heart disease. Then they put the result in simple terms so that patients can see trends and take action. This year, Nightingale took 3 big strides forward. They went public on the Finnish Nasdaq, which gave them capital to scale. They rolled out at-home testing kits so more people can benefit from their disease prediction. And they acquired a genomics company that will allow them to bake genetic information into their app and provide people with even more personalized health assessments. I sat down with Nightingale CEO and co-founders Teemu Suna to hear more about their blood testing technology and how it could change preventative health globally by getting patients to see their potential future, like Scrooge staring at his gravestone, and then change the course of their health. Enjoy. Teemu Suna, CEO of Nightingale, thanks for taking the time with me today.
Thank you.
It is exciting to learn what you're working on at Nightingale. Appreciate you sending me over that hour with Nightingale. Give us a high level of what is it that you've built at Nightingale for those who aren't familiar.
Yeah, so the Nightingale is all about preventative health, what preventative health means is that in order to kind of prevent something, you need to be there on time. You need to be there early. Mm-hmm. So what we are doing, we are basically providing our advanced blood test for healthy individuals. And then what we detect from blood, we don't kind of aim to diagnose diseases, but we rather detect kind of the state of the body, so where the kind of the health is heading to. And now when we talk about health, we are not interested in like one disease or 2 disease. We are interested of staying healthy. Yeah. And now what the kind of the benefit of the Nightingale test is that it very holistically captures various areas of health. And now when we can kind of from a single blood sample, we can basically describe the kind of the future health risks holistically. So when you know the future risks, you can take action. And now I think this is kind of the nice thing about all this. When you know your risks, you take action and you follow up with further blood testing where your risks are heading to. You are changing your destiny.
Yeah. Maybe a good way to understand it would be through the hypothetical journey of a typical patient. So maybe you could take me through that user experience from sort of blood test or somebody might be modestly concerned about their health, kind of through that journey.
Yeah. So kind of a very let's take like easy example like type 2 diabetes. And it's something that is being developed over decades. It's not something that like suddenly like appears that now it happened. Mm-hmm. It's rather something that the body is giving the signals, especially when you look the molecules in the blood. Okay. So now let's take a person who takes the Nightingale test, and the test says that, okay, your risk for type 2 diabetes is elevated.
Yeah.
And then kind of you may get concerned a bit, depends on the people, but the message is that this is not your judgment day. This is observation of your kind of how your lifestyle is treating your body.
Yeah.
And now you decide to take action. So for example, you make some changes in your diet. So you decide that, okay, for example, I eat like less carbs, or I eat more vegetables. And then what you do is that you apply that diet, or you change your exercise pattern. You apply that for a month. Then you come back and you take another test. And we show how the molecules in your body have reacted to the changes in your lifestyle.
Wow.
And now, kind of for the first time, I mean, lifestyle has been something something that you can read from the internet, like eat avocados, or exercise this and that, or kind of the internet is full of these different advices. But if you take that advice, how do you know is it working for you?
Yeah.
How do you know? You don't. You just believe because you read it from the internet, from your favorite blog.
Yeah.
But we can tell you, we look it from your blood, from your molecules, how they react to the lifestyle change that you did. And this is how you can learn your own body. This is how you can optimize your kind of future health trajectory. So you can change the course. Yeah. It's not like it's big part of health is in your hands. Not everything, but I mean big part of that is in your hands.
Yeah. You know, my understanding is that a core piece of Nightingale is that you developed the hardware necessary to pull all this additional health data out of a blood sample. And a lot of people don't understand how, you know, arduous that process is. And so maybe you could give us just a quick run through of kind of the actual hardware that you developed, and kind of how long that takes to bring to market. This isn't just something that you thought of 6 months ago.
Yeah. So first of all, we do not build hardware. So we are a software company. So we utilize existing hardware.
Got it.
However, what makes this very kind of difficult is that I'm coming back to the molecules. So we are looking at the molecules in the blood.
Okay.
And so if something in the process goes off even a bit, you make a mess. So you need to know what you are doing. So how we measure the blood is that we put the blood sample inside a high frequency magnet.
Okay.
This technology is called NMR, nuclear magnetic resonance.
Okay.
And what happens in the magnet, all the molecules in the blood, they start to resonate. And each of the molecules have their own individual resonance. And because all the molecules resonate at the same time, we can capture signal of multiple molecules like in one go. And but this is like, I mean, what do you do with the resonance signal of the molecules? Nothing. So the next step is that you need something. We have utilized our artificial intelligence algorithms to kind of transform that resonance signal into the units used in healthcare, like millimoles per liter. And when we have then did that translation, then we can start utilizing these molecules actually start to mean something. And now we have then managed to continue with this, that these kind of molecules we measure, they are actually connected to actual health outcomes. And the health outcome connection is being built by analyzing some of the world's largest biobank collections.
Something that strikes me about Nightingale is just how multifactorial this process is. When you think about the need to gather the blood, to analyze it in a deeper way, to then have the software, the machine learning that can really find those correlations, and then go even further. I understand you just recently made an announcement about getting into genomics, getting into even more personalized understanding of the individual. This is not just one slice of the journey; it's really an entire patient journey. Is that right?
Yeah, that's right. And the build up of this is like it has taken for I think we've been kind of building this for around like 7 years, and invested so far around like 50 million euro, and there is a lot of things to still do. But the point is like when we think about biotechnology, the very typical problem is that if you invent something, you have a biotechnological innovation. How that innovation? How do you create the value for the people? Well, many times the biotech company doesn't do that. They just kind of build the technology and that's it. But what has been our vision from the very beginning is that it's end to end. The value is created end to end. You have to be you have to have the world class biotechnology, but it's not enough. You have to build it, kind of process the information in a way that you can actually help people to uh, live healthier lives.
Yeah.
And then when you do it, I mean the complexity of all this, all the different components and parts, it's it's quite complicated in the end to get it working.
Was that one reason that I understand you went public on the Helsinki Nasdaq, the Finnish Nasdaq, this in 2021? What was the objective of that in terms of this kind of growth and scale that was necessary?
Yeah, well, what we are doing here is that we are actually building a global preventative health system. And this is something like if you look at the burden of the chronic diseases like type 2 diabetes, cardiovascular disease, out of all the healthcare costs, these are like 80 to 90%. And then and this is one of the biggest cost factors in like of nations.
Yeah.
And this is like we cannot solve the problem by just treating already sick people. We have to keep the healthy people healthy. But for this we need technology, we need a system that can do it. And this is what we do. And it's such a big mission that we need to be well capitalized. We need to be we need to have the resources to bring this technology available all around the world. And that's why we went public. And in the listing, all the money was for the company. So it's only about investing into the future growth.
I'm sure when you think about global impact, you think about your sort of initial core group of users and how any success that you see early on with them is something that could theoretically be extrapolated out and benefit, millions more people. What kinds of exciting results have you seen early on that you would like to see extrapolated?
Yeah, well, that's quite interesting. So we started the first thing we did, like once we got the technology built up and all these kind of mobile apps and everything. So once we get that done, the first thing we did was that we started to sell the service in Finland for a very limited kind of amount, very limited group of people.
Okay.
So we wanted to see what happens when people get this like holistic preventative health information.
Yeah.
Because we got a lot of people were challenging us, saying like, well, people don't change their behavior and people are not motivated, and we were saying that no, we don't believe this is correct. We believe that people are not motivated because we have not given them the right tools.
Mm-hmm.
So we wanted to test this, and so we built up a clinic here in Helsinki. We are a private healthcare provider in Finland, and then we started to sell the service. and we got like a couple of thousand of people running the service, and the striking thing was, and kind of many findings, but the most striking things. So the people who are the ones that many times are considered like, okay, like lost case in a way, that group made significant improvement, and it was half of that group who returned to the second test, because we can compare the first and second test, made a major improvement that is like changing the level, the risk level for them, and that is likely to have a strong long-term impact into their health outcomes. So we got the group that is the least likely to make the change something. They changed things when they got the right information and the right tools.
And just to clarify, just to use the type 2 diabetes example, we're not talking about someone just lowering their A1C levels because they have type 2 diabetes. We're talking about metrics that precede potentially precede diabetes, and sort of new numbers that help you direct your habits so that you might prevent something in the future. Is that right?
Yeah, exactly. And not only looking like one thing in your blood, like one biomarker.
Yeah.
Because these diseases like type 2 diabetes, cardiovascular disease, they're like systemic. The biology of these diseases is very systemic. So it's like many different molecules in the body. They indicate the disease early on before you have got the disease.
Yeah.
And this is what we measure. And then we can help people to change their kind of habits and the kind of their blood values in a way that they avoid, kind of in the best scenario, they avoid the disease altogether.
I noticed that you have come out with a really slick looking mail-in sort of biosample system now, and I wonder if you could explain kind of why that was important. We seem to be in this moment with Everlywell and other companies where people are getting more acclimated with sending in samples and wanting to take care of their health from home. So, A, why was this important for Nightingale? And B, kind of what do you think this opens up for you more globally?
Yeah, I think the big thing here is that many other companies in this domain, as you said, they are doing home testing, but it is based on in the lab where the sample goes. There is the traditional blood testing technology. So now the kind of the breakthrough here is that with the Nightingale technology, you get the holistic, the preventative analysis also from home, because the point here is that your lifestyle defines your future health risks. And where lifestyle happens, it happens at home. It doesn't happen at doctor's office. It happens at home. And that's why we need to bring the measurement technology also to home to help people to optimize the lifestyle. And then one thing I want to say about the lifestyle is like, people many times think about like, okay, well, now I never can eat any burgers, and this was my last beer. And this is not what we are saying. It's actually like, and I have done this personally. So I had like my lipid profile was not kind of in optimal shape.
Yeah.
So what I actually did, I didn't do a change with my lipids, but I changed the amount of carbs in my food, and that improved my lipid level. So I didn't know it. I just wanted to try it, and then I just decided that okay, I still eat potatoes, but maybe I take only half of what I take usually. That was the change I did. I still ate the potatoes and preserved my lifestyle. I just kind of tweaked that a bit. I measured, it worked, and I knew that okay, my body kind of doesn't like too much if I eat a lot of carbs.
Did you use the Nightingale system to do that analysis, or just sort of the Nightingale sort of mentality?
No, the Nightingale system. I actually measured my blood and followed up the progress, and I kind of quantified. I quantified my lifestyle in a way that I learned to know how my body responds into the change that I did.
Yeah. I want you to dream with me for a minute about kind of the global impact here if this is able to scale the way you're envisioning and really reaches the people who need it most. We just wrote about how 2021 was a record year for health innovation funding, doubled the year before. And yet we noted in the report that still 55% of the funding went to 3 cities. There's still a real disparity in terms of where money goes and where innovation happens. And you've been clear to emphasize that you want this to be for all people, not just sort of the 1% of people who are the most likely to get high tech care. And I get a sense that that's kind of baked into your business or the ethos of your business. And so I wonder, first question is sort of, how have you built that into Nightingale's roadmap?
Yeah, I think the important answer here is I think there are two things. One is the kind of the how we provide the results. So we are not providing, our results are not built for medical professionals.
Okay.
We have built this for humans. We have built it for people, kind of ordinary people. So, and this is important, like the current diagnostic industry, the results, if you know your apolipoprotein B, how many milligrams per deciliter you have it. I don't know what it means.
Yeah.
So I'm guessing that many other people also don't know what it means.
Yeah.
We actually measure it. But when we deliver the result, we deliver it in a way that you don't have to be the medical professional to kind of to get the value from the measurement. So it needs to be understandable. It needs to be actionable. So I think this is one of the key concepts what we are building. Then the second one is accessibility. So we need to get the technology to people's homes. And it's, as I said, life happens at homes. So we need to get there.
Yeah.
And then there is the kind of I guess then there is the third thing, which is the price.
Yeah.
So we are actually our aim is to push the price of this advanced biotechnology down. So we believe that the value is created when this is brought to the masses.
Yeah.
And maybe that is one of the breakthroughs, that we are actually bringing this advanced biotechnology for the masses. I think if you think about standard primary care technologies, they are not that like novel. So this is in a way quite a big thing to then allow people to access this kind of state-of-the-art technology.
How accessible are we talking? I mean, there's accessible pricing, and then there's products that can really be afforded by working people around the world.
Mm. Well, it's a bit of a different thing in different parts of the world. But how we are seeing, and what is one of the advantages of our technology, is that we can really kind of the price point is completely doable for middle class, like already.
Mm-hmm.
And when the volumes goes up, we can kind of come all the time. We always kind of put this development, when the price goes down, we put it into the pricing, and with that we get it to the bigger audience all the time.
What's your vision for expansion outside of Finland? I mean, there's sort of the business case side, and then also just your own hope and desire for impact.
Yeah, well, we are already kind of we have laboratories running in Japan, in of course in Finland, but then also in the UK and in US as well. In Japan, we have launched uh, our preventative health offering. So, and that's quite a major market to bring the technology. But then, because we already have operations in the US, I think the US market is very attractive, also for us. And I mean, the concept is actually something quite interesting. It's global.
Yeah.
Think about electricity. Electricity is not global. It's different in different. The system is different parts of the world.
Yeah.
Blood, blood is quite global, and and there are of course ethnic differences, but that's also something that we have managed to capture, for example, in our Japanese operations.
Well, and that goes along with your genomics efforts to understand, individual populations. Maybe you could speak to that. I understand you had an announcement about that just this week.
Yeah. Well, that's quite a major thing, and I think we need to start from like biology, and think about what the Nightingale blood test is measuring. So we are actually measuring the dynamic state of the body. So how your lifestyle, how you are treating yourself is kind of manifested in your blood. But then but that's not kind of everything there is. So there are also things that we are born with, and that is called genetics. So the genetic data is, you are born with it. You have inherited some things from your parents, but it is static data, so it doesn't change. So if we measure your genetic data when you are 5-year-old, it will be the same when we measure it when you are 50-year-old. But what it kind of provides, it provides kind of a fingerprint for your kind of future health.
Yeah.
But it's not also a judgment, because if you think about cardiovascular disease, type 2 diabetes, lifestyle diseases, kind of clearly the largest part of your risk is defined by your lifestyle. But now when Nightingale puts these two things together, so we put together kind of what you have inherited, and then we see how your body is actually doing. I mean, the analysis, the capability to understand your future risks, as well as what kind of actions you could take to kind of lower your risk levels. And let me give a practical example. So if your genetics says that you have a high risk for heart disease, and then we look your genetic data, and then we look your lifestyle data with the Nightingale blood test, and we see that okay, now you have the genetic risk, and your lifestyle is kind of average. So it then says that okay, because of your genetic risk, your kind of trajectory towards heart disease, you are likely to get it sooner than the population average.
Makes a lot of sense.
However, if you change your lifestyle, you can kind of overcome the genetic background, and you can end up in a trajectory where you are healthier in terms of heart disease than the population average.
Yeah.
So I mean, this is like
makes a lot of sense.
Yeah, but this is like groundbreaking. Many companies there who do genetic testing, many companies who do blood testing. But now when we put these two things together, we get advantages from both angles. I think it's groundbreaking.
Yeah. Where are you at in that process? If I was a Nightingale customer in Finland right now, would I get that genomic data added into my profile? How is that being rolled out?
Yeah, so the rollout is we as part of the announcement, we acquired a small technology company from Finland, specialized in genetic in genomics, and with that we get kind of a kickstart for the capability, and it's already in the second half of this year when we get the genomic perspective integrated into the Nightingale's mobile app, and it's then, I mean, as I said, it's kind of when it's there, then the expansion of that can be very rapid, because I mean, it's the same application basically that we can use also in other countries.
Yeah. You know, one of the things I love about Startup Health is that we work with companies from about 27 countries, and just the unique mindset that comes from every continent. Not everything is, you know, being baked in Silicon Valley. There's a lot of very different communities fomenting technology. And I wonder how you think being a Finnish-born company, being a Finnish company, and having this be your initial user base really shapes how you think, how the company thinks about impact and expansion.
Yeah, well, I think that there are some benefits of being from a small country, and maybe something that you don't consider that much if you are in from a bigger country. One thing is that Finland is a nation of like 5 million people. The only strategy, the only possibility is to get international. It's because you don't have a domestic market. I
Yeah,
mean, everything that you plan, you have to plan to the international market,
got it.
and that's a massive benefit. With Nightingale, we have built the scalability of this technology, like from the very beginning, that it can address the challenges of the uh, global market. So I think that is one of the great
Can I ask?
benefits.
Can I ask how you
Yep.
baked that in from the beginning? What are some ways that you were thinking global very early?
So we bake that in a way that when you build this kind of technology, you can build it like you can just kind of think about, okay, we do a small pilot here, and then when the pilot is ready, we start to expand. You end up having a scalability problem at some stage. So because we were thinking like, okay, there's no point to build anything just to the domestic market. We build kind of the scalability, like all the software, all the processes, everything in a way that it can scale in international scale.
Yeah. And that's been something that's you know, been baked in from the beginning. I mean, other aspects of sort of the Finnish mindset. I mean, I just like how entrepreneurs can learn from one another in their sort of regional outlook about business and about entrepreneurship. Is there a way that you think differently about business expansion based off of the sort of national, you know, philosophy of Finland?
Yeah, well, I think like we maybe the Finnish nationality, this kind of going through the rock attitude, that all the challenges are just made to be solved, and we know that when we start doing something, like when we have done a lot of funding rounds, like international funding rounds, we're always the underdog. We are always the one, like if I go to the US in a big like investor conference and I said, "Hey, hello, here I'm Teemu from Finland." I, the kind of the position I have is quite bad to start with. So then we know that, so we have to compensate with something. So we need to have like the stuff that we are talking about needs to be like super good, and then that,
I love it.
I mean, that creates kind of the attitude that wherever you go, you're always like a bit maybe maybe even a bit like too well prepared to be the underdog. And here we come through the rock. And I think Nightingale.
Well, it makes me think of the product itself. I understand that it can pull 250 times more health data from a blood sample than a typical test. So it's almost like that's the Finnish mentality, right?
Yeah. So it's exactly like that, and the aim has been to reach towards the impossible all the time. So what I'm saying, like I've been asked many times. So what is entrepreneurship? So I have tried to kind of summarize, and my favorite one so far is what I think this work is. It is all about making things that are invisible today, making them visible. Once you do that, you have succeeded, whatever you do. And this, like, the challenge is that if the vision and the mission, like with Nightingale, I'm talking like, okay, let's like build preventative health system globally. Most people don't see it. It's invisible, but I see it, and we will make it visible. And that's the core of this work, and that's what makes entrepreneurship so great. Because once you have created something to the world that really didn't exist when you started.
In your imagination, in that sort of invisible dream, do you see Nightingale on every continent? Do you see this really being a global enterprise?
Sorry, now the line was breaking a lot.
When you think in your mind about sort of that invisible dream, do you think about Nightingale being deployed on every continent? Do you think of that? Do you think of it that globally?
Yeah, most definitely. This will be if we think about primary care, I believe that this preventative health perspective and this preventative health thinking, that will be a very important part of future primary care. So I think it will be everywhere. And and my question is like, why not? So if the price point is low, if it gives tools to people to take better care of themselves, and if what is the side effect of Nightingale? What is the side effect of better lifestyle? there is not such a thing. I mean, because in medicine there are always side effects, but sure. Better lifestyle, I think there are no negative side effects. And I mean, it just makes sense in the big picture. I'm confident that the world will move towards this direction anyway. Nightingale will not be the only company in the world trying to solve this problem, but what I'm confident about, it will get solved, and our position to actually make it happen is it's so exciting that we believe that we can accelerate this trend heavily.
It's awesome. Okay, that's the time we have. Teemu, thank you so much, not just for taking the time with me today, but for being so dedicated to this vision, to bringing the invisible to life. And as you said, pushing through the rock, was that the term you used? Breaking through the rock? On such a challenging piece of healthcare innovation. So Teemu, I wish you all the best with Nightingale, and hope it's an amazing 2022.
Thank you so much, and thank you also for your time and for the interview.
Awesome. All right, be well.
Thanks for listening to Startup Health Now. Startup Health invests in health transformers from around the world who are committed to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 380 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Impact Fund in collaboration with AngelList, go to healthmoonshots.com. Thanks for listening to Startup Health Now. We'll be back next week.